Artificial intelligence, or AI, and virtual reality, or VR, are both informing the healthcare industry right now. Artificial intelligence is really kind of at the beginning of its journey, I believe. AI, at its core, is a collection of data points that informs process. And so in the healthcare industry for design and construction, if you think of all of the millions of projects that have been done and the data points that all of those projects have created, you can get that information, align it with the art and the science piece and the human experience of all of those projects, and really help to inform better outcomes. It increases quality, faster process and timelines, but it can also inform things like safety and quality on projects. Virtual reality, on the other hand, has gone more mainstream. We normally see it today involved in projects from the aspect of virtual mock-ups. And virtual mock-ups, as opposed to a physical mock-up, allows more participants to take part in the process. And it's a distributed model, meaning that you can have people from all over the US or internationally participate in reviews of projects without having to physically be there. And that allows clients to make much better informed and timely decisions earlier in the process, and it eliminates changes in the long run. The three things I really see that are going to impact the healthcare built environment as an industry in the near future are smart buildings, the right sizing of facilities, and then also future enabling of these facilities. And what I mean by future enabling is not proofing of the facilities where you're guaranteeing the future use of a facility, but actually enabling the building to morph in size and use and what it's going to be used for in the future by making smarter decisions today. That could be including prefabrication, modular technologies, and then also having enough float in your designs and the way you build to change the use of the facility again without having to have wholesale changes or renovation projects. On the right sizing of buildings, we really see the footprint of facilities getting smaller and smaller and more efficient. Projects are becoming lean, they're supporting the operations of facilities, and so their size themselves and cost of projects will be diminishing quite a bit. And as I started the smart buildings, the buildings I see are actually becoming the science themselves. They're managing energy. They also have a lot to do with the well-being and outcomes of the inhabitants that are in the facility itself. Those three elements will play a major role in the change in healthcare facilities. Two of the major trends that I see are impacting the industry today are both consumerism, and then the major point is disruption. Consumerism from the point of view that all healthcare clients, and even in the design and construction industry, are looking at patients as consumers. And so there's a very strong trend in the industry to attract consumers and then also have consumers as repeat business. So patients are becoming smarter, they're better educated, and so the buildings themselves, the clients, the healthcare providers must provide an attractive solution to those consumers. On the disruption side, the industry in healthcare is really ripe for disruption. So we have and are seeing many tech industries, non-traditional companies like Apple and Microsoft, and even Walmart and Target are getting into the industry of healthcare. Those companies are tech related, but they're also terrific at delivering product into the marketplace and also design solutions. And so they are going to be more and more involved in the future of healthcare. And if you just imagine for a moment an Apple store or your experience with Amazon, how will healthcare be delivered in the future will be completely different than what you're experiencing and seeing today.